My name is Sandro Galea. I serve as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. These are conversations that aim to highlight work that advances the science of health. This, in particular, is part of a series of conversations we are having about current changes to the policy landscape. The goal is to have non-partisan, science-based conversation, to keep an open mind about potential policy change, even to welcome potential change for the better, but to be analytic about how proposed changes may affect the health of populations. Today, I have the privilege of speaking with Kristin Brig-Ortiz, a lecturer in public health and society at WashU. She is a historian of environment and public health in Southern Africa, with a focus on coastal communities and urban life. Her current project is a comparative analysis of water management and urban public health in 19th century South African port cities. I'm very much looking forward to speaking to her today. Kristin, welcome.
Thank you so much.
So talk us through your research on historical water management systems. It is something I know nothing about, so I'm actually looking forward to learning from you.
So I'm currently working on a project on urban water management and public health in 19th century colonial South Africa. The three cities that I'm comparing are Cape Town, Durban, and Port Elizabeth, which has since been renamed Galea in 2021, but I'll be using Port Elizabeth for chronological reasons. And so my work is effectively looking at how, as British knowledge about water and health moved into South Africa and the Southern African region in the 19th century with colonization, it entangled itself and enmeshed itself with local and indigenous understandings and knowledge about water and health. And I'm arguing that this enmeshment shaped how British colonial municipalities, especially along the coastline, planned, built, and maintained water infrastructure, both physically and legislatively. It's really helping us to think about why are water systems the way that they currently are in South Africa, and how in particular does everyday mundane behavior play a role in the management of those water systems.
So lead us actually through this question. And so how do different communities approach water management in the cities you're studying, and how did the British colonial government respond to these? And I guess as a next question is, how did this affect the health of the public?
Sure. So it's a question I'm still developing, and I'm still trying to get the particulars on, especially for African and South Asian populations. But generally speaking, in Southern Africa at this time, the three major communities that were living in these cities were Indigenous Africans, so isiXhosa speaking and isiZulu speaking, and Khoikhoi as well, and Indian South Asians that were coming in, especially in Natal, from British indenturement. And of course, the British themselves constituted the kind of white majority in all of these cities. And so African water management very much depended on the natural landscape in this area. So thinking about open water sources like rivers and streams, and thinking, really dealing with rivers and streams as both sacred and useful objects for society. So there was a huge cultural significance around managing water in these societies that very much influenced who was able to get water in local African communities and how they were able to use that water in an equitable way. Indian South Africans were much more drawing on, especially Southern and Northern Indian notions of water management that also had some cultural significance, but that drew on other technologies as in addition to rivers and streams. So thinking about, you can think about wells as an important part of Indian water management. The British themselves are much more invested in thinking about ideas like new progressive ideas about, or what we would think of as progressive ideas about water infrastructure. So bringing in wells and bringing in tanks, especially using different kinds of metal to construct these technologies, but also thinking about centralized piped water infrastructures. And this was very much influenced by new notions in public health like sanitary theory developed by Edwin Chadwick in Britain, and germ theory, which was coming largely out of Central and Western Europe in the late 19th century. And so there was, in the British frame of mind, there was much more of a shift from this cultural understanding of water as something that belongs to the community as a whole to a much more clinical public health notion of what is clean water and what is wastewater and how do we keep these things separate.
And so how did indigenous practices influence this water management in the South African landscape?
So indigenous influences were very much, again, about open, using and managing open water supplies. So, in the British mindset, the British wanted to have total municipal control over open water supplies in general, because they saw those as particularly prone to, becoming dirty, becoming polluted. Whereas for Indigenous Africans, this was much more about like, how are we allocating water within these open streams and rivers? So thinking about, for instance, they had, for most African societies, it was like an upstream, downstream policy of using water. So you collect your water for drinking and cooking upstream from where you do your washing and dump your other kinds of waste. So these things do not, so these two things do not mix. But, this kind of ran into an issue with British municipal systems because most often many of the waterworks that the British created and planned were downstream from where Indigenous Africans were dumping their pollutants. And so there was kind of this clash over how best to manage, especially these open water sources, and how these open water sources in African behavior around them was very much affecting municipalities and municipal residents on a daily basis.
And how does this history lead to how water is managed today in South Africa?
So this is one of these questions that I'm still working through, especially when we have to take the apartheid era into account, and what apartheid did to the South African urban landscape. But I would argue that there are a couple of big things that we can take away from this. The first is that as in many places like St. Louis, like New York, like Baltimore, like other places in the Western world, these cities in South Africa actually largely rely on infrastructure that was built in this period. In Cape Town, for instance, you can still see and go down into some of the stormwater sewers that were built in the late 19th century, and that still function as stormwater sewers in the city. And so as a result, you have, there have been mounting complaints from people about how the infrastructure is leaking too much, and that the municipality is not taking care of the infrastructure as well as it should be. But again, a lot of this infrastructure takes a lot of maintenance to maintain, and especially when you think about how long it's been sitting in natural environments that are not necessarily happy with the British style infrastructure that was put into place in Africa. And so, there's a question about the actual history of the structures itself and what needs to be done to preserve that structure or perhaps replace it to create a better system. The other big takeaway I have is actually around behavior and thinking about why are people behaving the way that they are around water management infrastructures today? In public health, we think about a lot of these big contextual factors already, especially thinking about the social determinants of health, thinking about the socio-ecological framework, how much money are people making, what is their access to water actually like, what kinds of technologies are they interacting with on a daily basis. But I would actually argue that a lot of the behaviors that we're seeing today in terms of dealing with water infrastructure in these cities descends from this kind of hybridization of British water management coming down during the colonial period and mixing with local and indigenous understandings and behaviors around water.
Lead us through how access to clean water intersects with public health more broadly, but in particular with health disparities.
Right. So, clean water is fundamental to every single part of our lives. If you even think about how much you've used water today. I think this morning, I used it to shower, I used it to make my coffee, I used it to brush my teeth, I've used it to wash my hands multiple times. And so having that access to clean water has enabled me to fulfill all of those kinds of behaviors and to be able to do all of those actions and keep myself clean and healthy, not only for myself, but for the people around me. And when you don't have access to clean water, you can't do those actions. You can't do those behaviors. You can't keep yourself healthy and clean. And that's, when you multiply that on a large scale, you then have communities that are prone to becoming more ill. You have communities that can't deal with their waste, right? You have, multiple issues within kind of the broader context in which people live. And so having access to clean water enables communities to become healthier and to be able to become empowered in their lives as well. Because if you think about, the less time that you have to spend going to the pump in the morning means that you probably have more time to perform work, to be able to earn a wage, to be able to go to school and get that education that you need. And so, it is about very much those actions in daily life and how we can sustain ourselves healthily, but it also has these much broader reaching impacts that fundamentally can change how someone is able to pursue the life that they want.
Lead me through how we link these implementations, water management systems, access to clean water, to public policy, because I think sometimes it's hard to remember that there are actually deliberate acts of policy that lead to the more downstream implementation that leads to water management and then people's access to water?
So public policy is something that is, I think, fundamental to infrastructure management as a whole. I mean, there's only so much an individual can do in regards to, dealing with, the pipes in their home. You need a much broader buy-in from the public and from the government to be able to, build and maintain infrastructure. Um, and so for public policy, there's also, I think for any policy there has to be struck this balance between paternalistic policies, so making sure that, people, we're kind of enacting policy that is enabling broad changes in behavior while at the same time allowing people to make decisions about the kinds of actions that they're able to pursue and the kinds of behaviors that they think will lead them to healthier and more successful lives. But I think for water management, I think most people agree that we all need clean water. I think this is a very, a universal good and a universal ask. And I think one of this, especially when I talk to my students about this, and they're like, well, why in the world do we not have, policies where everyone has equal access to clean water? And a lot of this does come down to money. So, in thinking about, well, how do you satisfy, private investors that are helping to fund large scale infrastructural schemes? How do you keep, government officials happy that, if their constituents especially are in a place where maybe there's less water than another constituency, how do you kind of handle or deal with those different requests from different constituencies? So, but at the end of the day, I mean, this is something that I think everyone wants to see more access to clean water on a kind of global and larger scale. It's just like, what kinds of people do you need to buy into that public policy to make that happen?
How about urbanization? Because a lot of what you're studying has taken place against the backdrop of urbanization. So how has urbanization historically shaped water management and public health? And what are your thoughts about urbanization today as it intersects with these questions?
Pipe systems and a lot of the public health policies that we now have today were very much influenced by especially industrial urbanization in the 19th century. Edwin Chadwick, when he first proposed sanitary theory, did so because he did surveys of urban living and especially working class lives in urban settings and how they were being affected by industrialization. And a lot of this has to do with the fact that in most cities, especially in the 19th century, water supplies were not nearly as clean as they could have been because there weren't any regulations on, there were very few regulations on polluting. There was very few public movement to create, kind of massive water infrastructure. And so, but municipalities and municipal officials saw a need and they decided to fulfill that in large part by instituting, kind of centralized water systems that they could then surveil and make sure and ensure that everyone had access to clean water, as many people as could actually buy in. And so urbanization, I would actually argue, is central to the way that we're thinking, especially about piped water systems today. And in large part because that's where the political will is, that's where the money is, and I think that's probably where we see the starkest inequalities actually happen.
So you're a historian, so I feel like I have to ask you this question. So what are the key lessons, the key challenges, key opportunities that you think we can learn from the past, the period that you study, that are applicable today?
So I think there are a couple of big ones. I think the first is to remember that infrastructure is a contentious thing, and especially that, as much as we love to think that everyone should have access to clean water, that there are a lot of moving parts when it comes to planning, building, and maintaining a huge water infrastructure system. And that's not just an engineering issue, that's also a public health issue. And I think sometimes maybe we get lost, in the mix of thinking and trying to divide these two particular areas when actually they're very much in line with one another. The other big thing I would say is, to really listen to communities. And I know that we do this all the time in public health these days, but to really remind ourselves that, there are particular behaviors in communities that maybe they look non-normative to us, or maybe they don't look, they look like an unhealthy behavior. And, maybe stepping back and thinking about, well, what are the historical structures behind why a community is behaving in a certain way? Not just thinking about, our present, the present context in which they're living, and the present issues that they're facing, but also thinking about the kind of the more historical knowledge that they're drawing from and how embedded that is within their community, and expressing a little bit of empathy and like, why are they actually performing that behavior, even if it seems contrary to what we think should be happening.
That's a terrific answer. Last question. What gives you hope in the moment?
I think that people recognize that these are issues. It's just they don't really know how to collaborate and solve these issues together. So, yes, there is a lot of disorder in the world. And, I think one of the big issues with water that I feel like I'm reminded on a daily basis is that we seem to be running out of water, or that's kind of the narrative that we're told. But there are people that are increasingly recognizing that this is a problem, and not just at the kind of professional level, but also from everyday people that I meet and talk with. And so there's a will to do something. It's just, how do we actually enact that will, and how do we get to a place where people feel comfortable about investing in a scheme that maybe looks a little big to them.
Thank you, Kristin, for the work you do. Thank you for joining us.
Thank you so much for having me.